Welcome to Wednesday's edition of the Daily Report. Plans to transition into normality are gaining ground with the launch of a special committee assigned with the task of ensuring a safe and effective return. Now, we have more on this later on in the program after a look at the pandemic updates with our Kwon So-ah. Now, so let's start then here on the domestic front.
All right, Sunny. Now, as we have reached the middle of the work week, we are seeing the usual pattern of increases, but it's not an exponential surge. 1,584 cases were tallied as of 12 a.m. And with an unchanged figure in imported cases from yesterday, the number of domestic cases has risen to 1,571. So for a closer look by region, the capital Seoul has jumped by around 100 cases from the day before, and around 51% of infections in the capital are currently unidentified infections, and around 41% in Gyeonggi-do province are still unidentified infections. Meanwhile, there's been a rise here in Chungcheongbuk-do province, 88 cases. That's the highest case for a daily, single-day infection cases this year so far, and that as many infections there are linked to foreigners, students, and also children. Meanwhile, down in Daegu, 66 cases. Here, a lot of infections are linked to chain transmissions linked to religious facilities. Now, following the end of the Hangul Day holiday, we've been seeing an increase for the second straight day here. But comparing Wednesday's figure to last Wednesday, when we had over 2,000 infections, it is a significant on-week drop. With that, the average in daily domestic transmissions in the past week stands at 1,745. And the total number of cases in Korea accumulated so far stands at 335,742 with 2,605 fatalities with 11 additional deaths. Onto our vaccination front, we've surpassed a milestone in those that are fully vaccinated yesterday, over 60% now, and that's equivalent to around 31.2 million people. Let's take a look at the figures abroad. In the past 24 hours, as of noon Korea time, over 447,000 new infections and more than 8,700 fatalities related to COVID-19. For a detailed look at some specific countries, India is seeing a dip in infections in recent days. However, it has now hit the 34 million mark in total infections. Meanwhile, Russia here is seeing resurgences with 28,000 infections reported in the past day, and it has also hit a record high of daily deaths, and that number stands at 973 on Tuesday local time. And those are the general updates I have for now, but I'll see you back again. Sunny?
All right, So thank you for now. Right, now well into our second year of the pandemic, authorities are looking to shift their COVID-19 strategy for a gradual return to a stronger sense of normality. Now, for more on this shift, I have Shin Yeun in the studio. Yeun, good to have you back.
Pleasure's mine.
Right, so as you reported yesterday, that is Tuesday, a panel of advisors from the public and private sectors has been set up. Let's start there.
Right, so on this Wednesday, Korea launched a special COVID-19 transition committee that's aiming to restore a sense of normal life by November. And normal life meaning COVID-19 being treated as an endemic disease, along with the reopening of the economy, schools, and cultural activities. The committee is made up of a mix of public and private sector figures. Prime Minister Kim Bu-kyum is co-chair with Professor Choi Jae-chun from Ewha Women's University, joined by cabinet-level officials from different ministries and experts in various fields.
Right, and Yeun, I hear the committee held its first meeting earlier on this Wednesday. Tell us about what was addressed then.
Right, so a range of topics were covered, starting from the economy, education, culture, and healthcare to the COVID-19 situation that's affecting different regions. And at the beginning of the meeting, the Prime Minister said the country's high vaccination rate has created the necessary conditions for a gradual return to normal life. As of Tuesday, Korea has fully vaccinated more than 60% of its population. Take a listen.
Now that the country has secured strong disease prevention measures and high vaccination rates, we are ready to steadily return to life as normal. But, as we've said numerous times, this does not mean taking masks off right away.
So as the Prime Minister said, not taking masks off right away, that shows that he really wants it to be gradual. And so he also made 3 relevant directives. The first one is returning to normal life gradually. The Prime Minister specifically said that returning to normal does not mean taking off our masks right away. And the committee mentioned it would consider implementing a vaccine pass that fully vaccinated people can use to access certain venues and services. Second, the process must be an inclusive one. The government is especially looking to help people who lost their jobs or didn't receive proper education due to the pandemic. Lastly, the committee has vowed close cooperation with the public in its exit strategy, and the Prime Minister said all of its decisions will be made only if they fully align with public interests. And the committee will be providing a specific roadmap by the end of this month, which puts the country much closer to its goal of launching its new COVID-19 strategy on November 9th.
Right, and before November 9th, though, I believe authorities will make public their new social distancing guidelines later this weekend.
That's right. With the current social distancing measures set to end on Sunday, authorities will announce new guidelines on Friday, and these will be implemented from next week. And while they didn't specify the exact guidelines or how the measures will change, they did mention it'll probably be the last set of guidelines before they start implementing an exit strategy. And authorities could also provide rule exemptions for those who are fully vaccinated.
I see. All right, Yen, thank you for that. And do stay behind for the extended talk with our Kwon Soa, of course. And speaking of Soa, she is back with details from the latest government briefing on COVID-19 related matters. Right, Soa?
That's correct, Sunny. So a health ministry official had more on the discussions at the transition committee. So Son Young-nae at the Central Disaster Management Headquarters said all members of the committee saw eye to eye on the need for 3 basic policy directions that Yen just earlier briefly mentioned. So let's take a closer listen to what that entails.
전반적으로
The committee recommended that we make steady efforts to restore a sense of normality, despite the risk of a temporary rebound in infections in the process of reopening the economy and easing restrictions. The members also agreed on the need to lift restrictions gradually in phases while prioritising public safety and keeping the outbreak stable. Lastly, they saw eye to eye on the need for support measures targeting those who are financially or socially disadvantaged.
And Sun also said that the committee will continue to operate after we have successfully transitioned into a life living with the coronavirus. The General Committee will get together at least once a month, and subcommittees will get together twice a month. And that's with an aim to continuously gather a wide range of opinions to reflect the nation's people's opinions in these policy directions.
Right. Now, so countries that have adopted exit strategies are fighting resurgences as we speak. How are authorities here planning to address this concern?
Well, authorities do have their concerns because we are still seeing more than 1,000 cases a day, and especially because they are mentioning that people are fatigued from the prolonged social distancing measures, and because the nation's people are having that expectation of this new strategy, the so-called living with the COVID-19 strategy. So experts have been especially mentioning that movement across the nation is still at a high level. So according to Son Young-nae, the official earlier, from October 4th until October 10th, movement has been going down in the metropolitan region by 3.8%, but it has been going up by 3.6% outside the metropolitan region. So pretty similar, the number there. And that is said to be at a high level. So the officials are stressing that basic prevention measures have to be abided by continuously. Also, as Yen earlier mentioned, that masks still have to be worn even if we do transition into that phased strategy, returning to our normal lives. So here is a message from Son Young-nae earlier on that issue.
Although vaccinations are progressing smoothly and the outbreak appears to be stabilising, it is too early to completely let our guards down. There are still many citizens who are unvaccinated, and lessons from abroad show us that indiscretion can lead to a worsening outbreak. We ask you to gather your strength and take an active part in our prevention efforts.
Right, and so one final question though. The goal of fully inoculating 70% of the population, I hear, may be reached sooner than expected.
Right, Sonia, along with its forecast of a phased return to our daily lives next month, the government is confident that the 70% goal may be achieved before October 23rd. If vaccinations for those roughly 36 million people are complete by the 23rd, a gradual return to normalcy could start on November 7th or 8th, considering the 2-week span that's needed for antibodies to be formed. But if the target is reached before the 23rd, a shift towards our new COVID-19 strategy could start at an earlier date. The speedier vaccination process, meanwhile, is attributed to active participation, in particular as people are making use of surplus vaccines, enabling them to receive their second shots earlier than their original schedule. As of Tuesday, more than 1.48 million people got their second shots through surplus vaccines.
Right, well, that is an encouraging move there. Now, Yen, I'm going to turn things back to you. You earlier mentioned vaccine passes as part of efforts to ensure a sense of normality, or to ensure a phased return to normality, that is. What more can you tell us about these vaccine passes?
Right, so before I go into detail, I want to explain what a vaccine pass is. Well, most would already know. It's actually a type of health certificate that fully vaccinated people can use to enter bars, restaurants, and other venues. And in the case of Korea, the debate just started whether or not to implement these vaccine passes, mostly because we've now inoculated a majority of the population. And authorities have said they would monitor how these passes are being used abroad before making a final decision. But a few government officials today actually suggested a temporary vaccine pass system be implemented this month. And this would be like a prep before we go into November, and to allow pass holders to stay at restaurants and cafes past the 10 p.m. limit up until midnight. And another idea that they had for this temporary vaccine pass system would be allowing gatherings in larger groups beyond the current limits, as long as everyone is wearing a mask.
Right. And for the sake of comparison, Yen, what can you tell us about vaccine passes in other countries?
Right, I think we first have to look at Israel, the first country in the world to have implemented what they call a green pass, and they've actually implemented this in February, but they've recently changed the criteria on who's eligible to be issued a green pass. Before, it was given to those who have been fully vaccinated or recovered from a natural infection. Now it's only given to those who received an extra booster shot. And Italy took a much more extreme approach. Starting next Monday, it will become the first European country to require these passes at the workplace. And if workers fail to abide, they'll be given a 5-day suspension from work, after which their salary can be withheld, but they won't be fired.
Now, as Italy's measure is expected to be the strictest in Europe, in fact, Italians, some citizens have already took to the streets because they are concerned over discrimination between people that are vaccinated or not vaccinated. And that's an example that Korea should also take a look at, because according to Son Young-nae, the official at the earlier briefing, Korea has been looking at examples of green passes or vaccine passes in the UK, Israel, Germany, Portugal, and other countries as well. But they did say, as this was just the first meeting of its kind, they have not been making specific discussions regarding that vaccine pass as of yet, but they have rather laid out the general direction of where this should go, and also the agenda they have set up for their next meetings to come.
Right, and I am sure that authorities here are also exploring the option of providing or allowing members of the audience, members of the public that would be, to provide proof of negative COVID-19 tests if they can't be vaccinated.
Right, and that is also the case in many other countries as well. For instance, the U.S. as well. Some federal workers, I believe, they have to prove that they have tested negative for the virus if they choose not to get vaccinated.
Right, and so staying with you now. Yeon mentioned earlier about the new social restrictions that will be announced this Friday. What are we expecting?
Well, some pundits are saying that this could mean a relaxation of private gatherings in places under level 4 social distancing that would be including the capital Seoul. So maybe up to 8 people, if they include vaccinated people, can get together. So the ban on private gatherings of 5 or more people might be eased. And also they are expected to be discussing whether coffee shops and restaurants can open after 10 p.m., so until midnight. Another thing that's being discussed is whether there could be an easing of measures at sports games so that more people can watch these games. And we will have to see, because this question was also raised at the earlier briefing, but according to Son Young-nae, the official, he did not reveal any details on that. But again, he said that today and tomorrow they will make discussions, so we will learn on Friday most likely.
Right, so we'll just have to wait then.
Yes.
All right, so thank you for now, and yeah, and I'll see you again tomorrow.
Thank you.
The Biden administration holds no hostile intent toward North Korea. Now, this is according to U.S. Security Advisor Jake Sullivan in response to North Korean leader Kim Jong-un's recent allegations of such intentions. Our Yoon Jung-min reports.
During a meeting with his South Korean counterpart Seo Hoon on Tuesday in Washington, U.S. National Security Advisor Jake Sullivan reaffirmed that the U.S. has no hostile intent towards North Korea. The Blue House National Security Office says Sullivan has reiterated that the U.S. is willing to meet the North for talks anytime, anywhere without preconditions. They have assessed constant efforts by Seoul and Washington for diplomatic engagement with North Korea at various levels and agreed to continue close cooperation on the issue. The message from the U.S. came after North Korean leader Kim Jong-un criticized the U.S. on Monday, saying there are no grounds to believe Washington is not hostile toward Pyongyang. Speaking to reporters after the meeting, Seo said he also explained the Korean government's end-of-war declaration in detail to the U.S. South Korean President Moon Jae-in has suggested declaring a formal end to the Korean War at the UN General Assembly last month.
As for the end-of-war declaration, we have explained to the U.S. our plan, and the two sides have agreed on close discussion. Above all, I have reaffirmed the U.S. government's significant interest and will for the progress of peace on the Korean Peninsula.
Also, there have reportedly been elementary discussions regarding Kim Jong-un's latest remarks. In the readout, the White House National Security Council called on North Korea to enter into serious and sustained diplomacy for the complete denuclearization, adding the need for the North to refrain from escalatory actions. As for bilateral ties, the U.S. top security advisor called the South Korea-U.S. alliance a strategic linchpin in the Indo-Pacific, instrumental in resolving regional issues and issues related to climate, health, and new technology. The two sides have discussed follow-up measures from the Moon-Biden summit in May, which include partnership on vaccines, climate, technology, and semiconductor supply chain. Also discussed were global issues and affairs related to the Korean Peninsula, stressing the importance of Seoul-Washington-Tokyo cooperation on those issues. When it comes to regional issues, Seo said Sullivan shared with him the results of the latest U.S.-China high-level talks, and they discussed China's role in Korean Peninsula affairs. Yoon Jung-min, Arirang News.
Right, and the U.S. State Department, for its part, has also reiterated hopes for dialogue with Pyongyang. Here's our Kim Hyo-sun.
Washington once again stressed that it remains open to dialogue with Pyongyang, adding that the U.S. harbors no hostile intent towards North Korea. Responding to a written inquiry from Seoul-based Yonhap News Agency, a spokesperson from the U.S. State Department explained Washington is prepared to meet with the North without any preconditions to engage in serious and sustained diplomacy. The official said the U.S. hopes the regime will respond positively to its outreach. Explaining that Washington's ultimate goal is to keep American people and its allies safe, the official added that the regime's nuclear ballistic missile programs continue to pose a threat to the U.S. and its allies. The remarks come after the North's leader Kim Jong-un reiterated that the U.S. has a hostile policy against the regime while addressing a defense development exhibition held Monday. Kim also claimed that the regime's enemy is neither South Korea nor the U.S., calling for the need to further advance its military capabilities in order to be strong. Washington has continued to maintain the same stance when responding to North Korea's series of short-range missile tests last month. Pyongyang, however, remains unresponsive to America's outreach. Kim Hyo-sun, Arirang News.
Meanwhile, in yet another display of military might, North Korea has put on show an unprecedented defense development exhibition, including some of its top weapons systems. Ji-young has more.
Intercontinental ballistic missiles that can strike South Korea are displayed on the left, and those that can hit Japan, Guam, Alaska, and the U.S. are displayed on the right. Showcasing some of the most advanced weapon systems that North Korea has developed over the last 5 years, the regime staged Self-Defense 2021 in Pyongyang. One of the standout items on view were the mini-submarine-launched ballistic missiles that can be loaded on 3,000-ton submarines. They're seen as an upgraded version of the KN-23 Iskander ballistic missile that also has the technology to intercept and evade ballistic missiles.
I believe that the regime is pushing to make the Iskander ballistic missile into a submarine-launched ballistic missile. If successful, several of them can be loaded on a submarine and will have the capability to attack South Korea on the flank or from the rear.
North Korea's hypersonic Hwasong-8 missile that the regime claims to have tested last month and which potentially could be one of their fastest and most accurate weapons is also on display at the exhibition. With the sharp warhead, what seems to be the medium-range missile is on a launch control trailer. Another recently revealed weapon that North Korea test-fired last month, a ground-launched cruise missile with what the regime claims to have upgraded mobility, detection, and tracking abilities, could be seen as well. North Korean leader Kim Jong-un attended the exhibition to review the weapon systems that were on the show. The Ministry of National Defense said that South Korean and the U.S. intelligence is closely analyzing the regime's new weapons system. Ji-young, Arirang News.
On the domestic front, employment here in Korea marked its largest expansion in about 7 years, even amid the various restrictions to contain COVID-19. Our Min Soo-kyun has more.
South Korea last month posted its biggest monthly jobs gain in more than 7 years, despite the fourth wave of the pandemic. According to Statistics Korea on Wednesday, the number of people employed totaled 27.7 million in September, up 671,000 from a year earlier. This is the largest increase in jobs since March 2014, when the number of employed people jumped by 726,000. It also marks the 7th straight months of job gains. Employment figures have been on the rise since March, following 12 consecutive months of on-year decline. The agency attributed September's growth to several factors.
Despite strict social distancing measures, the number of employed people was up for 7 consecutive months due to improved economic activity, the transition to a non-face-to-face digital economy, as well as the base effect from job losses last year.
By sector, health and social welfare, transport and logistics, and education services saw strong employment figures, driving the local job market up. But the wholesale and retail sector still struggled and was down by 112,000 jobs on year. Other in-person service-based businesses and the manufacturing sector also underperformed. Meanwhile, the country's unemployment rate fell to 2.7% last month, the lowest for September in 8 years. Unemployment fell for all age groups except for those aged 60 and older. The economically inactive population also dropped to 16.7 million last month, down for the 7th consecutive month. Min Soo-kyun, Arirang News.
And Korea's ICT exports in September hit an all-time high to reach over $21.3 billion. The Ministry of Trade, Industry and Energy said on Wednesday this amount is up roughly 21% compared to the same period last year and has grown on year for 16 straight months. The growth in exports has been linked to the digital transition and global economic recovery. Semiconductor exports rose roughly 27%. Cell phones were up almost 20% and computers, as well as computer parts, increased nearly 50% on year. Come next Thursday, Korea will mark a new chapter in its space technology as it launches its first homegrown rocket. Kim Do-yeon has more.
Nuri, South Korea's first homegrown space rocket, is ready for takeoff next Thursday. According to Korea Aerospace Research Institute on Tuesday, the team is now undertaking a final review of the overall launch operations after completing technological checkups. This means 11 years on from the start of its research and development. The space rocket is fully assembled and ready to carry a dummy satellite weighing 1.5 tons into high, low Earth orbit, around 700 kilometers up.
Before an actual satellite is put into orbit, in this first launch, through data analysis, we will be able to confirm that the launch vehicle we have designed operates normally as planned and puts the dummy satellite into the targeted orbit.
The three-stage rocket will be propelled using 4 75-ton liquid engines in the first stage, one in the next, and a 7-ton liquid engine in the third. This would make South Korea only the 7th country in the world to have independently developed such technology.
Looking at what we have, we can tell you that South Korea has caught up with advanced technologies by 70% compared to advanced countries, and I can tell you that we feel proud.
The country's rocket history goes way back to the 1990s when KSR-1 was launched less than 100 kilometers above Earth in 1993. Since then, not too much progress was made before Nuri's predecessor, NATO, whose first stage was built using Russian technology, reached low Earth orbit in 2013. Nuri, or KSLV-2, is a collaboration involving more than 300 different South Korean firms. Following the success of this launch, the team will start preparing for another launch in May of next year when the rocket will carry an actual satellite for use. Kim Do-yeon, Arirang News.
A very sad and shocking social phenomenon that is taking shape here in this part of the world is solitary death. Now, findings show there has been an unsettling rise in the number of people dying alone, usually at home, especially in light of the sense of despair brought on by the pandemic. We have more on this reality in this report.
Solitary death refers to people dying alone after being isolated from their families and friends and remaining undiscovered for a very long period of time. Deprived of social contact amid the pandemic, more and more people die alone at home. The number of solitary deaths reported in 2020 when the pandemic began stood at over 4,000. Last year, an average of 11 people died alone a day, which is about 2.5 times higher than 8 years ago. In August, a man in his 30s took his own life and was discovered 2 months later in an apartment in Incheon. On one side of the room, about 10 propane gas bottles, empty soju bottles, and rotten foods were piled up. In the case of solitary death, special cleaning is required because bodies are usually discovered after a certain period of time after death.
고독사 현장은 아무래도 이제 오랫동안 외부와 소통이 단절된 경우가 많아서 술병이 많이 쌓여 있다던가 아니면은 음식물이 많이 쌓여 있다던가 아니면 쓰레기가 쌓여 있다던가 그런 특징들이 많이 있는 것 같습니다.
There are many different causes for solitary death, but many experts cite social deprivation due to the increase in single-person households as the main cause. According to the Ministry of the Interior and Safety, the number of single-person households in Korea is about 9 million, which takes up over 40% of the total.
고독사의 주요 원인으로 이야기하는 것이 이제 관계망의 단절과 고립입니다. 관계망의 단절과 고립의 위험이 있는 사람들이 코로나19 상황에서 거리두기가 정책화되면서 훨씬 더 다양한 관계망을 접촉할 수 있는 기회가 줄어들어서 이런 문제가 좀 더 심화되지 않았나 이렇게 예측하고 있습니다.
Moreover, the rate of solitary death among the younger population has increased sharply since COVID-19. The number of people aged under 40 who died alone in 2020 surged 62% compared to 2017. The one-person households consisted of young people are in a social blind spot as the nation's welfare system considers those population as young and capable of working. To address such a problem, local governments and welfare centers in the Seoul metropolitan area are striving to prevent solitary death. In addition, the Act on the Prevention and Management of Solitary Death has been in effect since April this year, but there is still a long way to go before developing a systematic policy.
거시적인 차원에서는 좀 사회적으로 직업의 기회가 늘고 노동 환경이 좀 안정화되는 것이 굉장히 중요하겠고, 그다음에 미시적인 차원에서는 실제로 관계망을 회복하는 지역사회 차원에서의 노력이 필요하다고 생각합니다.
Over in Japan, the country has carried out the Zero Isolation Project since 1990. Through the project, the country selects those who are considered at high risk of solitary death as subject to preventive care. In the UK, the loneliness agenda is seen as a strong cross-cutting issue. To tackle loneliness, the government has come up with customized measures. And Denmark is preventing loneliness through building the residential community.
Solitary death is no more an individual issue, but rather one of the major social problems to be tackled. There needs an improvement in the social safety net, as well as kind interest and careful approach to those isolated to prevent further solitary death. This has been 신세벽.
A special committee to support efforts to ensure safe and effective transition to normality has been launched here in the country. For more on these efforts, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
And I also have Professor Sarah Ok-shin from Korea University. It's been a while, Professor Shin.
A pleasure to be back.
Right, Professor Kim, we'll start with you then. The daily tally has been hovering below the 2,000 mark in recent days. What is your assessment of the current COVID-19 situation here on the local front?
I'm very optimistic, if we look at a 7-day average of our confirmed cases, it showed a peak in the end of September, and after that it started to decline. And since we are making average of 1 week, it's a very powerful number. That means that it's going to decline, and we have to watch for 1 or 2 weeks more. But I think it's a good sign that the confirmed case is declining slowly. But still, we have to be vigilant against any new variant emerging. And that's the point I want to mention.
Right, and talking about vigilance, Professor Shin, there are some people though who are talking about the possibility of seeing 5,000 new cases per day later this month. In the case of greater travel to mark the autumn season, what are your prospects?
Well, so as Dr. Kim has mentioned, that the numbers of infected cases are slightly increasing over the weekend, but it's not exponential surge. So you have to be still vigilant, because when we think about what happened during Chuseok holiday, we have seen, the numbers of infected cases exceeding 3,000 cases right after Chuseok holiday. And that was still under, level 4 social distancing rules. And so we just had 2 consecutive long weekends, and we have seen increased levels of people moving around and mingling, going out of town for vacations. So the increased movement of people definitely means, the numbers of infected cases might go up. So there's a possibility that we might see, the numbers of cases to go up within a couple of days, given the incubation period of COVID-19 variants. As a reminder, although we are seeing much less cases with severity or mortality with increasing vaccination rate, the government just started, setting up the transition committee, and we just started talking about the roadmap for living with coronaviruses. So until we have detailed long-term plans, I think we still have to keep the infected cases down so that, our medical system can handle, these numbers of infections.
Right, and speaking about infections, Professor Kim, 1 out of every 5 new cases has been found to be a breakthrough infection. How do you explain this finding? And do you believe breakthrough infections may perhaps pose a greater challenge to containment efforts?
Somehow it's going to be challenging. If we look at the breakthrough infection in September, it is increasing by week from 10% to about 20% right now. And if this result come with a decline of cases, we have to search for many possibilities, reasons for this. And for the recent 2 weeks, people more than 80 years showed the highest breakthrough infection, which is about 74%, and it's much higher than younger age group. So that might be explained by 2 ways. That one is it might be the evidence that we need a booster for elderly people because their immunity is declining day by day. And the other possibility is that this age group might have started to loosening their social distancing because they are too confident about their immunity against COVID-19. So we have to look at both ways, but I would like to mention 2 countries right now. One is Singapore. Now they have very exponential increase in cases right now. It's much more higher than U.S., UK, whatever. And already 83% of their population is vaccinated. And among the confirmed cases, more than 98% are asymptomatic or very mild. And the patients who need oxygen is about 1%, and the patient who need ICU care is about 0.1%. It's very low. And about half of the confirmed cases are already vaccinated. I mean, it's much more higher than 20% of Korea. So if we are going to make a policy to live with COVID-19, if we want to give up a COVID-0 policy, we have to watch what is happening in Singapore and learn lessons from them. The second country I would like to mention is Israel. I think they are one of the first countries to start booster shots for the vaccine people. And they had a very high surge in the late August, and now they're declining. I think they are giving the booster shots with some kind of quarantine measures. And if we follow up these 2 countries, I think our government will be much more easy to make our own policy.
Right. Professor Shin, as Professor Kim mentioned, in Singapore, 83% of the population there is fully inoculated. Now, earlier on in the pandemic, we spoke about how 70% of the population being vaccinated would offer us with a threshold for herd immunity. What are your thoughts on this now, herd immunity?
Well, so the 70% vaccination completion rate was actually given by the government when we had very low reproduction number. Which is determined by many different variables, but we know now that with the emergence of variant viruses, this reproduction number has increased quite a bit. So, in my opinion, the herd immunity is no longer, an option for us, especially even if we get every single one of us gets the vaccination completed. Realistically speaking, we already began talking about coexisting with COVID-19. So in near future, COVID-19 will be treated just like the flu, common cold flu. So for us right now, I think just a game changer is going to be finding an acceptable and highly effective antiviral drug like molnupiravir that we'll talk about in the discussion later.
Right, that is the case. Meanwhile, elsewhere, it's been almost 3 months since authorities in England declared freedom from pandemic-related restrictions, but their fight against COVID-19 infections continues. Now, for a glimpse of the situation there, I have Dr. Mark Jitt at the London School of Hygiene and Tropical Medicine. Dr. Jitt, it's a pleasure to see you again.
Great to be here.
Right now, Dr. Jit, the UK recorded over 40,000 new infections last Thursday for the first time since early September. And again, this past Monday, the daily tally hit above that level. What more can you tell us about the COVID-19 situation there?
I think the number of cases in the UK has been pretty stable since July. There's been about 30 to 40,000 cases every day. The surprising thing is not that it stayed high, but that it hasn't gone up further. The reason is because in July, almost all COVID restrictions in the UK were lifted. So there are almost no restrictions on, going out, on economic activities, on mass gatherings, on face coverings, and so forth. So I think the reason cases haven't gone up despite the removal of all restrictions is really because of vaccination, because of the fairly high vaccine coverage is what is preventing cases from increasing. But since we've gone back to almost like a pre-COVID levels of restrictions, I think that is what's stopping the numbers from going down. I'd add that the number of deaths is it's lower than it's been with previous waves, and that's because most of the older and most vulnerable people have been vaccinated with 2 doses.
Right. And talking about vaccination, Dr. Jit, healthy children aged 12 to 15 over in the UK are being offered 1 dose of the Pfizer vaccine since late last month. Now, what is behind the decision to offer a single dose to those in this age group?
Well, the reason for that is there were some risk calculations done on the individual risk of the individual benefit from vaccination versus the risk of a very, very rare possible side effect of vaccination in children, which is myocarditis. I would stress that this is a very rare event. There's less than, maybe 1 case per 100,000 or even less where this happens. But if you base it on individual risk calculations, then the first dose gives the most benefit and has the very, very low risk of myocarditis. The second dose gives less extra benefit because most of the protection comes from the first dose and then has a higher risk of myocarditis. I do want to stress this is a very rare event, and the calculations that were made don't take into account other benefits, which I think possibly governments might also want to consider. For instance, helping the adolescents, the teenagers who get vaccinated, preventing them from missing school if they get sick or their friends get sick, preventing transmission in the community, preventing so-called milder cases of COVID, which can still be quite severe in some cases and maybe lead to long COVID. So I think if you take those into account, I can see why other governments have recommended 2 doses.
Right. Meanwhile, Professor Kim, as part of efforts to ensure a gradual return to normality, authorities here are expanding at-home treatment. Now, for those who have mild or no symptoms, what can be done to further support this treatment at home?
I guess some patients will welcome that decision to let them stay at home, and some people might be worried about their health situations. And for the patients, they should be compliant. They should follow the rules that the government is giving for their quarantine measures. And if the patient have some kind of comorbidity, or if the patient is in a situation needing a caregiver, we have to think one more time whether to let the patient stay at home or whether do as we did previously. And I guess they might need some kind of personal equipment which they can use at home, such as a small device checking the oxygen saturation, which is very cheap and available right now. For the government side, I think they have to use the beds available. We have a network of facilities that communicate to admit patient, and it should be work very efficiently. Sometimes it doesn't work out pretty well, but if more patients going to happen, and if they have to stay at home, and somebody might get worse, and we have to be ready. So more beds should be available.
Right. And Dr. Jit, what can you share with us about making effective use of at-home treatment, which I hear is an active option over in the UK?
Yeah, well, the policy on home treatment has been the policy actually since the beginning of the pandemic. almost the beginning of the pandemic. Most, cases of COVID are recommended to self-isolate at home and only to seek care if they're supposed to monitor their own symptoms and then to seek care if the symptoms worsen. The reason for this is the vast majority of cases of COVID will improve without any hospital treatment. So this both allows patients to self-isolate at home and prevents the hospital facilities from being overwhelmed. So, yeah.
Right. All right, Dr. Jit, as always, thank you for making the time to join us live at this very early hour at your end.
Great to be here. Thank you.
Right. And Professor Kim, now going back to what Professor Shin mentioned earlier about Merck's antiviral COVID-19 pill, could you remind us a bit about its efficacy? Because we've touched upon it quite a bit.
Yeah, it's a little bit early to talk about it because we don't have many information about it. Anyway, this new drug named molnupiravir, it inhibits the viral application because the structure resembles the materials that the virus needs, and it can go in to make when they make their own RNA, and that RNA doesn't work properly, so the virus is going to die. And it does not target the spike protein, so it might not be dependent on a new variant, which is a good news. Clinical trial ended prematurely because the benefit was clear with this new drug, so which is a good news. This study included more than 700 subjects, and the admission rate with the people who got this medication was only 7%, while the compared placebo group was about 14%, which is 2 times higher. And I would like to compare with Tamiflu, which we had at the influenza outbreak in 2009. Molnupiravir is effective if it's administered orally within 5 days of symptom onset, which is almost the same as Tamiflu. And side effects, there's no safety profile for pregnancy right now, and during the clinical study, they prohibited any unprotected sex for a week after finishing this medication. So this is something we have to take care about. And I would like to go to the price issue. I cannot talk about the price in Korea right now because we don't have it. But for Tamiflu, it takes about $150 to finish the 5-day course, about 10 pills. But the price of molnupiravir is very shocking. I mean, you have to take 8 pills a day for 5 days. Totally, you have to take 40 pills for a course. And there is a drug price expert in Harvard University. They say it's enough for $17. But the company, Merck, says they're going to charge $700. So it's going to take about $3,000 per course. So even though we have that medicine, if the price is too high, it's going to be very difficult to use it in a large scale.
Because most people will not be able to afford it.
Yeah. So vaccine is going to still be necessary even though we have these medications. So that's the thing we have to remember.
Right. And staying with this drug, Professor Shin, 2 Indian drug makers are looking to end late-stage trials of their generic versions of Merck's molnupiravir to treat moderate COVID-19. Could you tell us a bit about this event and its implications?
Yeah, so 2 Indian companies independently tested genetic form of molnupiravir in people with moderate disease, they claim, but they dropped the trials because they saw no significant efficacy in these people. Although they do say that they will plan to continue the clinical trials for people with mild illness. So, why there's no high efficacy, you might ask. So spokesman for Merck points out that these clinical trials that Indian companies ran actually included people who have been defined as more severe than moderate. So in terms of, so they have different criteria or different degree of severity for people with the severe symptoms versus moderate symptoms. So maybe the Indian clinical trials include more severe cases, so maybe that's why they didn't see much more effect than we expected. Mm-hmm. But anyway, nonetheless, as I mentioned before, I think this pill could be a game changer. Although Dr. Kim has mentioned that it has some issues with the price. Right. But I can definitely, decrease the severity and death significantly. So I think an effective oral drug could be an incredible asset against the fight against the COVID-19, for sure.
Right. And Professor Kim, what are your thoughts now? We've started offering booster shots and they're being offered to medical healthcare experts on the front lines of the pandemic. What are your thoughts now on the timing of booster shots for the elderly? Because initially for the inoculation, we made the elderly a priority, but they seem to have been pushed behind healthcare workers. What are your thoughts on this?
Well, it's very hard to say which has more priority. Health officials, they need booster shots, and elderly people, definitely they need it. Well, I would say that both of them should be immune against COVID-19 until the end of this pandemic. And well, if we look at the elderly people, if you are more than 60 years of age, you have a more high rate of breakthrough infection. And in Korea, about half of the breakthrough infections, they are all more than 60 years of age. So definitely we're going to need that. I don't know the recent data, but in August, we had a screening test for the antibody positive rate in our population, which was very low at that time, about 0.3 to 0.5 among our Korean people. Since we had vaccination started and there are more confirmed cases, it's going to be much more higher. But this high-risk group, if they got infected, they're going to go to the ICU. So definitely they're going to need some kind of booster shots. And for medical personnel, even though our government will ease the quarantine measures, the hospital has to stay with some strict rules for some time because we don't want any nosocomial infection happening inside hospital.
Of course not. Right, Professor Kim, as always, thank you very much for your thoughts. And Professor Shin, thank you for being with us today.
Thank you.
Right, efforts to return to a new normal will require the support of all members of the public, as is the case with COVID-19 containment measures. So do seek to abide by all prevention efforts. Thank you for watching.